Please help explain the type of questions that have two similar answers. For instance, after assessment of pain and analgesic administration, what's the next critical step? She had A, documentation, B said reassess, and there was no C or D. So let's walk through this. You assess your patient and you give analgesics. Analgesics are given for pain. What is the next thing you're going to do? Well, the nursing process says the first thing you're going to do is get information. You're going to assess. We did that. You're going to do a nursing intervention. You gave the analgesic. What is the next action? You're going to evaluate. You just gave the patient an analgesic. You just put something in that patient's body that can cause a change. You need to evaluate. Did it work? Didn't it work? Because that's going to tell you what you're going to do next. So after you give that analgesic, if it's opioid analgesic, it could cause decreased respirations. It could cause, patient can have an adverse reaction. So after you've done your nursing intervention, the next thing you're going to do is evaluate. And evaluation may be another form of assessment, taking your patient's vital signs, asking them how they feel, asking them about their pain rate 1 to 10. Right? So you do your nursing intervention, and the next step is going to be evaluation. Now, after you evaluate that patient and you realize, whoa, this didn't work, what's the next thing you're going to do? Well, if the patient has something PRN and it's within the time frame that you can give them, you're going to do that. If not, guess what? You're going to have to call the healthcare provider to do something else for your patient. But guess what? You're not going to do that until you what? Reassess your patient. You're starting all over again, right? So let's recap. You assess, perform a nursing intervention, evaluate to see if that nursing intervention worked, and if it did not, you're back to step A, assessing. You got to see where you went wrong. What's going on with your patient? Get information, because guess what? If you always choose call the healthcare provider, what you going to tell the healthcare provider if you didn't even do an assessment on your patient?